well, there's a lot of misconception about this whole holistic thing. The idea that you have the allopathic or the normal conventional thing and the holistic thing is complementary or alternative to these things. I don't like these terms because they're not alternatives. They're a part of looking at the whole picture. And it's not complementary. Complementary meaning it's to be used in addition to the conventional? No, not necessarily. It's all one whole picture. And yes, we can use some of the medications that are in vogue for the conventional therapies, but we have a lot more things that we can add to the picture.
Two things. The first one is, what are holistic practices for pets? And then I want to cover off what some of the modalities are to use.
Let's say that I have an infected ear in front of me that I'm treating. That infected ear, on the conventional side, you say, well, what is the problem? Well, it's an infection. You've got bacteria in there that are propagating and causing a reaction. That's what the conventional thing, and the therapies for that would be kill the bacteria. The holistic approach to that same problem is saying, well, it really isn't the bacteria that's the problem. It's the fact that the body is not strong enough to prevent those bacteria from being a problem. So unless we actually try to improve the body's response, improve the terrain, if you will, we're not really going to cure this problem, because that ear problem is going to come back and come back and come back.
Does that mean that you're looking at the immune health of my pet? Is that the baseline that you're looking at? Is how healthily immune is this dog?
But every function of the body has to be looked at as an integral part of health and well-being. But a lot of the medications that are used, for example, in treating infections and what have you, are detrimental to the terrain, are detrimental to the healing process. Even though they're on the surface, you think by killing off a few bacteria with antibiotics, for instance, you've done the patient a lot of good. Probably not, because there's a lot of negatives to antibiotics. Anybody who's had a long course of antibiotics will be able to tell you it is not necessarily improving your well-being. They may be detrimental in the long haul. And a lot of the patients that I see on a regular basis are over-medicated to their detriment and not productive in again, the health of the terrain.
Nutrition is one way to approach it, right, holistically. What are some of the other aspects that you can approach holistically?
The common things, the things that people are familiar with are, for instance, herbal medicine. Now, herbal medicine can be used from a palliative way as well, but it is really helping the body system, the integral part of herbs working with the body to improve the body's function. Homeopathy, which is the energetic side of the coin, which is often looked upon with some skepticism, but homeopathy is of value, again, in trying to promote the body's function. That's the whole principle of the homeopathic approach. Acupuncture, same thing on a very physical level. This is the energetic planes that are in the body. We're trying to motivate that to happen. And of course, the therapeutic nutritionals. These are commonly used, and we use them all the time, trying to improve the body's function through providing an optimum level of vitamins and minerals and tissue salts and whatever we have to do to motivate that body. So there's a lot of very simple and elementary things. Omega-3 fatty acids, probiotics, all of these things can be used to enhance the body's ability to fight and keep wellness. People who are practicing totally conventional, I think the problem with that is that they're missing a lot of the other modalities that can be of value.